A long time ago, in 1861, Samuel A. Kinney Wilson was the first doctor to observe and diagnose this disease. Now it's named after him, Wilson's disease. Wilson's disease is relatively rare, occurring in approximately 1 in 30,000 people, with lower prevalence rates in North America compared with other parts of the world. The median age of diagnosis is 17, occurring most often in young females with a 4-to-1 ratio. According to some studies, Caucasians and South Asians are primarily affected. Many people have this disease. However, symptoms do not show up until a large amount of copper accumulates in the body. This is an autosomal recessive disorder, which is usually not present in consecutive generations. For instance, if one parent has this disorder, that doesn't necessarily mean you will too. Specifically, this gene is called ATP7B. It gives your body instructions to make a protein that helps transport copper from the liver. When this gene is mutated, it can no longer perform its function, resulting in accumulation.
Copper may build up primarily in the central nervous system, liver, and the brain. The first hallmark sign of Wilson's disease is Kaiser-Fleischer rings of the eyes, which is visibly seen as a brownish-yellow color around the eye. Further symptoms include tremors, slurred speech, stiff muscles, itchiness, and swelling of the tummy. Liver symptoms include jaundice, liver disease, and cirrhosis. We may also see a decline in school performance, personality changes, and impulsiveness. If Wilson's disease is detected early and treated appropriately, people with this condition can usually enjoy a happy, healthy life.
But not to worry, the key to successful management of Wilson's disease is early treatment. This helps to prevent end-stage organ damage and interventions such as liver transplant. The treatment involves the removal of copper deposits from the body. That is known as chelation. Penicillamine contains sulfahydryl, which binds to the copper and thus removes it through the urine. The side effects are neurological deterioration, fever, rash, bone marrow suppression, lupus-like symptoms, and protein in the urine. There is also another drug called triantine. It contains nitrogen, which binds to the copper and secretes the copper into the urine. The side effects include anemia. Since triantine has fewer side effects than penicillamine, it is usually the first-line treatment. There's also a third drug that's called zinc. Zinc helps to trap copper in intestinal absorptive cells, which are then sloughed off in the intestinal lumen. This will then be excreted when you have bowel movements. Zinc can cause some gastrointestinal side effects. However, it is most commonly used in maintenance after using more aggressive decoppering agents. Zinc is also the preferred treatment for pregnant women. Symptomatic treatment will include the management of neurological symptoms, for example, with the use of antidepressants. Finally, end-stage liver disease would result in performing a transplant. You should avoid foods high in copper, like chocolate, nuts, dried fruits, mushrooms, shellfish, and liver. A vegetarian diet has been found beneficial. Additionally, abstain from alcohol. We also suggest that family members get genetic testing to see and check if they are carriers of the gene. This can help potentially identify the disease early and also begin early treatment. It's also really important that you follow your medication regime, as this also allows your body time to heal and recover. Sometimes, based off these clinical manifestations, the general population may not understand the potential severity of their symptoms. If you have experienced the symptoms I've talked about, make sure to speak to your healthcare provider.